Now, you need to know that what we first started this by saying that what the wound dressing technique is going to base on the stages of the wound healing that you have found. When you are, let's say that you have already done the debridement is complete. When you are at the level of the inflammatory phase of the wound healing and you have already visualized all the signs of inflammation, which are swelling, tenderness, redness, loss of function, and warmth. You have identified all the signs of inflammation, then you know that it is the inflammatory phase of the wound healing, and then you realize that there is pollen discharge and cells discharge, is it clear, which may tell you that it is infected. Is it clear? So all that is going to help you in order for you to do an antibacterial wound dressing. Basically, you need to do by this phase of inflammatory phase, you need to do an antibacterial wound dressing or a chemical debridement wound dressing. Basically, so those are the two types of wound dressing that you have to do at this phase. Antibacterial wound dressing means that what means that you're going to clean the wound with normal saline, is it clear? And then later on, or you are going to apply on the wound certain products which are antibacterial. Example, you have Banyosin. Is it clear? So Banyosin is or you have mupirocin. Is it clear? So those are certain pomades which are antibacterial, which have antibacterial action. Is it clear? So you apply Banyosin or mupirocin at the level of the wound, and then you close the wound. Is it clear? Particularly when you are in the inflammatory phase of the wound. Is it clear? You can apply this product. Is it clear? Now, the next one, if you don't have, the patient doesn't have enough money to apply to buy for this pomade, so that you do antibacterial wound healing, wound dressing, you can also do the chemical debridement wound dressing, meaning that what you still use the product that were used in debridement but in lower concentrations. Like in the case of sodium hypochlorite, like you can use salt. Is it clear? You can use salt, you put in water, and then you do a wound dressing with that in the patient. So you cover it when you are closing the wound. Is it clear? You can also use Dakan, that's sodium hypochlorite. You cover the wound with the Dakan in order to kill and remove the devitalized tissues. Is it clear? You can also cover the patient with hydrogen peroxide in the wound in order to remove those devitalized tissues. So depending on which, when you are in the inflammatory phase, those are the two major things that you can use. This one is more local, the chemical debridement wound dressing. Is it clear? Now, the next part is when you are at the level of the proliferative phase. So that was the first case when the stage was inflammatory phase of the wound healing. The next stage of the wound healing is the proliferative phase of the wound healing. Proliferative phase of the wound healing. So now, when you are in the proliferative phase of the wound healing, you need to know that what in the proliferative phase of the wound healing, you have granulation tissues. So on physical examination, you're going to visualize granulation tissues at the level of the base of the ulcers. Is it clear? And generally, you don't have again those signs of inflammation at the surrounding tissues. Is it clear? So that is going to tell you that you are more at the level of the proliferative phase of the wound healing. When you see granulation tissue, and we have already said the characteristics of good granulation tissue and poor granulation tissue that you can use. Now, for granulation tissue, when you realize that you're in the proliferative phase of the wound healing, the wound dressing is now done. Wound dressing at the level of the granulation phase is now done with wound dressing in the granulation phase. Wound dressing in the granulation phase does done with normal saline. Is it clear? You do wound dressing with normal saline and honey. Is it clear? So wound dressing, normal saline. So this honey is also called L-mesitran. L-mesitran is what is being sold in the pharmacy. Is it clear? So when you realize that in the granulation phase, you use normal saline in order to clean the wound. You don't use again those hypertonic products that are capable of destroying the new cells which are growing. Is it clear? Just use normal saline, and then you use now honey or L-millisecond. Now you use honey because honey has certain peculiar function. The first function of honey is that it's going to have an antibacterial effect. Is it clear? It has an antibacterial effect, meaning that what when you close the wound with honey inside, it prevents bacteria from growing in the wound. Is it clear? That's why honey is important. So it has an antibacterial effect. The second action of honey is that it's going to proliferate granulation tissues, good granulation tissues. Is it clear? Honey also proliferates good granulation tissue. And the third function of honey is that it's also a pore debriding product. It's a pore debriding product, meaning that what if there are other or other dead tissues around, the honey is going to remove it. Is it clear? So that those are the characteristics of honey which make it to be best used in the granulation phase of in the proliferative phase of the wound healing. Is it clear? So those are the characteristics. So you first wipe the tissues with normal saline and gauze, clean and sterile gauze, and then the next one is that you use honey to close the wound with. Is it clear? Because he has these three characteristics: antibacterial, promote granulation tissue formation, and has pore debriding technique. And also it does not kill the living tissues, because all those chemical debriding wound dressing with hydrogen peroxide, sodium hypochlorite, if you continuously use it on the wound, you are never going to have a successful wound healing. Why? Because the new tissues that are going to grow, the hydrogen peroxide and the hypertonic sodium chloride are still going to kill the wound. Also, betadine should not be used in this phase of the proliferative phase of wound dressing. Don't use betadine nor alcohol. Alcohol is not even advisable in wound. Even betadine, generally you don't use betadine in the management of wound dressing. Some people may use betadine or alcohol, but if you want to use those products, you just need to use it in the chemical debriding technique when you're in the inflammatory phase. After the inflammatory phase, don't use again all those antiseptic product or aseptic product or disinfectant products. Don't use them again. Now, after the proliferative phase, the next phase now is the remodeling phase. The remodeling phase. Now, in the remodeling phase, you need to know that there are two major characteristics in the remodeling phase. The first characteristic in the remodeling phase is that there is scarification. Is it clear? There is production of scars. Is it clear? And it is in the phase that we have the hypertrophic scar and we have also keloid. Is it clear? So we have scarification. The second thing in the remodeling phase is that if you don't have scarification, the scarification is going to primarily occur in when you have secondary intentions of wound healing, or when you have secondary intentions of wounding, that is when you are going to have scars. But now the next one is that if you have apposition of the borders of the wound, you're now going to have primary intention of the wound healing. Or if you don't want the patient to have scars, you may do a graft, a skin graft. You place a skin graft just above the skin of the patient, such that it's going to prevent him from having scars. Is it clear? So if you do grafting or the healing is done by primary intention, you are not going to have scarification, but you are going to have epithelialization. Is it clear? So those are the two major things that occur inside the remodeling phase. The remodeling phase, you have it is either scarification when you have a healing by secondary intention, or you have grafting and other healing techniques by primary intention. You are going to have epithelialization. Is it clear? Now, in the remodeling phase, you need to know that what you can use different types of of wound dressing in the remodeling phase to promote epithelial. If you want to promote epithelialization, there is wound dressing technique for that. For epithelialization, the first wound dressing technique that is used, it is a paraffin wound dressing. Is it clear? You use paraffin wound dressing. So in this paraffin wound dressing, you're going to use a particular gauze which is coated with paraffin oil. Is it clear? And that paraffin oil is going to promote epithelialization. Is it clear? So particularly when you do grafting, you can also place those paraffin wound dressing in order to promote epithelialization. Is it clear? The second product that can be done, you can, if you don't have paraffin wound dressing, you can do a wound dressing with honey wound dressing or elmecitran. Is it clear? Honey wound dressing. So wound dressing is going to promote both epithelialization and also going to promote scarification. Is it clear? So in both of them, epithelialization and scarification, but particularly epithelialization. So that's what another function again for honey. Is it clear that you have to note? So those are the different methods of wound dressing. And now I've forgotten also to explain the fact that what in the case of chemical debridement wound dressing, you can still call it a hydrocolloid wound dressing. Is it clear? You can still call it a hydrocolloid wound dressing. Hydrocolloid wound dressing is just a wound dressing that is going to, or hypertonic wound dressing, they are the same thing. Hypertonic wound dressing or hydrocolloid wound dressing or chemical debridement wound dressing. In this wound dressing, you just use products that are very hypertonic such that they can pull the debriding tissues into the ulcer base for it to be easily cleaned out. Is it clear? So those are the different techniques of wound dressing that you have. So after knowing the different techniques of wound dressing, you can now best understand ulcers.